Okay. So, once again, listening is a receptive skill. Receptive skill, that means it is nothing in your hands. There is nothing in your hands. Everything is there in your brains and readiness in your ears. Remember that. Listening is a receptive skill, not a productive skill. It is a receptive skill. That means how well you are able to grasp. If you are writing, you can write something. If you are speaking, you can speak something. Whatever you want to speak, you can speak. Whatever you want to write, you can write. But it is not like that in the reading and listening. So somebody is giving some information and everything is dependent on the other person who is speaking. You should be ready to understand, ready to find out, ready to discover, ready to fathom, ready to unravel things. Readiness. You are a zero here. In writing and speaking, you are a hero because you can speak what all you want. Even you can speak nonsense and you can write nonsense. That is no problem, something you are doing. But here is not the case. You are silent. You are zero here. You're not the batsman. You're not the bowler. You're only fielding. Only if the ball comes to you, you can catch it. If the ball comes to you, then only you can catch it. So you're just a fielder. Remember that. You have to save yourself. It will go through the slip, or it can go overhead, or it can go high over the sky. You should be only ready to catch it. That's all. You have no chance. You have no chance. So you have to be ready to catch the answer. You have to remember a physics equation. Okay? Speed is equal to velocity into time. Okay? So that rule you have to follow. How fast the word is coming. How fast the answer is coming. How far it is from me. How fast the word is coming. How far it is. And in how much time it will reach me. Am I ready for that? 1 second I delay, the ball will fall in my hands and it will touch the tip of my hand and fall down because I am late by 1 second. If I am early to catch the ball, I close my hands, the ball will hit the top of my hand and fall down. Exact second if I catch, the ball will be in my hands because I am joining my hands. I am joining my hands to catch the ball. So, am I before time or on time or after time? So, I should be on time. Exactly when the answer comes, I must be ready. If I am ready for 10 seconds and the answer is coming in the 11th second, I lost the answer, finished. If I am ready from 12th second and 20th second till the 20th second and the answer comes in the 11th second, I am lost. Because that particular second only the answer came. It came and went, that's all. It came and it went. It's just like you are standing in the railway station and you went out to buy a book and the train came and went off. And you run, you chase, you cannot catch the train or the bus. So that is how it is. Exact time it leaves. So you should be alert at that particular time. You went to somewhere to buy a book or have a cup of tea or something else. And the bus started and left, finished, you're lost. So be very careful. That particular time is very prominent. So if you are waiting for the answer and you are not ready when the answer came, that means you are lost. Be careful. That is what I am telling you. Because if it is a reading part, at least you can see and search again if you lost the answer. You can revisit the paragraph, you can revisit the line, but that's not possible in listening. Be careful. Be careful. Extra careful. So, and that too in the beginning itself it is there. If you are careful, listening is the easiest. There are students who got 500 out of 500 also. It's not very difficult. In IELTS also, there are students who got 9 out of 9, my students. PTE, 90. So, it's not difficult. It's not impossible. You can do it. But how are you going to do it is more important. Focus is very important. Now, listening part in the beginning, so be careful. There are 3 parts. So we are going to the second part. There are 42 questions. And here you have 40 minutes. Total 40 minutes you have. And then you have only once the recording. It will not be repeated. So be careful. It's a warning. It's a warning. Alarm bells are ringing. Next one. You have to know 3 different parts, familiarize with each and every part. Every part has a separate approach or strategy. That's called practical approach. You cannot deal the part A with the same style as part B or part C. Content. Once again, I am telling you here, content is medical, but it's a common content. It is appropriate for healthcare professionals in all the 12 different professions. It is not profession specific content. It is general content. That means it is same for all the fields. Everyone can understand. So that is the point here. If you are a nurse, it is not going to help you. If it is a doctor, not going to help you. If you are a podiatrist, not going to help you. It may be anywhere. It may be a podiatrist or a dentist or a neurologist or a nurse with a doctor or a doctor training a nurse or a senior nurse training the junior nurses or anything it may be. A doctor talking to a patient or a review or anything. Anything simple as that. Anyone can understand. But the thing is, it is regarding professional aspect. It is medical subject only. That means content is medical, but the subject is English. You are not tested for medicine. You are not tested for nursing. You are not tested for any specific medical field, but you are tested for English only. Be careful. Okay. That is important. How well you are using English, that is tested. How well you are using medical knowledge is not used here. So remember that. Medical knowledge can be excused, but English college will be taken to task. The listening type test does not require specialist knowledge in any particular healthcare field. Special, particular, special, particular. So there is no need of any special knowledge. You need not have any special knowledge. Just if you have ordinary, common, normal, usual, general knowledge, that is enough. That is what he's telling. That is called commonality. Commonality is the factor here. There is no difference whether it's a nurse or a doctor. It's common medical knowledge. And for common medical knowledge, you are not tested. This is not a medical test to have specialist knowledge in medical field. No, no, and a big no. You should have only general knowledge regarding your medical field. That is enough. But special knowledge regarding English you should have, because English is tested here. Criteria is English. Common is medical. There is no use here. There is no value for this one. The value for this one is here. The listening content tests the candidate's level of English language proficiency in a healthcare specific environment. English language proficiency, how excellent you are. Do you belong to A grade, A level of English knowledge, A1 or A2? A1 means beginner, A2 means elementary, B1 or B2 means pre-intermediate or intermediate, C1 or C2, upper intermediate or advanced. What is your level of English language proficiency? Are you using a word called good? That means you are useless. That means you are a beginner. Good is A1 level. Good is A1 level. Okay. Excellent is B1 level, suppose. So like that one, B2 level or B1 level. Then what's the difference? So that proficiency is testing. Okay. Is testing how well you know English. Next, let us study the 3 parts. So now we are moving to part B directly. Yeah, here it is, part B. There are 6 different extracts from various situations at the workplace. One may be in a podiatrist area, one may be in nursing area, one may be patient discussing with the doctor, one may be doctor training a junior, or one a senior nurse guiding a junior nurse. It may be anything. It may be a training session. It may be a review session. It may be an appointment with the patient. It may be a discussion regarding a particular, not discussion, sorry. It may be monologue, only monologue. Okay. So they'll be telling something. From that you have to find out what his means. And they are related to the workplace. In each extract, you hear healthcare professionals either talking to each other or to a patient. So one healthcare professional talking to another healthcare professional, or one healthcare professional giving orientation to a junior, or one healthcare professional talking to a patient, or one healthcare professional talking to a caregiver or a nurse, like that, or a parent, whatever it is. There is one multiple choice question to answer regarding each extract. One multiple choice question only. One question, one topic. So the part B lasts around 10 minutes. So that means it may be around 45 seconds each, or 50 seconds each. Then the test assessment. So it does the ability to understand everyday workplace interaction. Are you matured enough to understand professionally? So that is part C, that is leave it. Now let us see Okay. Part C. Sorry, finished. And now I'm giving you regarding instructions. I'm giving all these instructions. Why? Because when you are jumping, bungee jumping or something, before going to war or doing any activity, you take all the precautions. For example, if you are going to cook, you put on an apron so that the oil will not fall on your clothes. The water may not spill, or your clothes may not be dirty. So you take all precautions there. That is what I'm telling you. So before each recording, you hear information about the context and instructions about what you have to do. For example, now you will hear a dietitian talking to a patient about his dietary regimen. So he will tell like that, who is talking, with whom is he talking, and where are they? He will tell everything. So in a meeting or in a discussion or at home or in a clinic, he will tell the background. 3 things he will tell. One, he will tell who is talking. Second one, with whom he is talking. And third one, what is the scenario or the background. So these are not that much important, but you should at least give an ear to them. Because if he says podiatrist, immediately you will be ready with all, your mind will start activating your vocabulary. Your mind will start activating your vocabulary. If he says nurse explaining the procedure of insulin injections, then immediately you will understand that it is the procedure. So she will tell where to give the injections, how to use the injections, how much insulin should be given, a dosage, and how many times a day, and what to do with the syringes used, where to take the injections, how to keep the area clean. So all these things will be explained. So once he tells the background, if he says, okay, if he says cardiologist, immediately you will come with the words related to heart. If he is a pulmonologist, immediately you start thinking, your mind will be ready. Your mind will be activated. So unless and until you listen to these things. So if he's a patient, that means he's talking to a patient, that means, so he will talk about symptoms, causes, diagnosis, treatment, recovery, progress. All these things will be discussed. For example, a doctor is giving training, okay, to a nurse regarding safety and first aid. Immediately your mind will get activated. Okay, what safety, what first aid, when do we need safety, when do we need first aid, all mind will be ready. So like that it will be activated. So be very careful. And these instructions are of 2 types. Now you have 3 teachers. First teacher is the teacher who is talking through the audio. He tells you, now you will hear a pulmonologist talking to a patient called Jane Andrews. Regarding asthma. So immediately your mind gets activated. Pulmonologist, patient, asthma. So your mind will be activated. So be ready for that. And the second teacher is on the paper, on the question paper. There also it is there printed. There also it is printed. Now you see, every question has the introduction. You hear the manager, okay. See here, you hear the manager of a care home for the elderly talking to the nursing staff. You hear the manager of a care home for the elderly talking to the nursing staff. Care home is the scenario, background. Manager is talking and is talking, okay, to the nursing staff regarding the elderly people, aged people. So aged care, so it is related to aged care. Those who people cannot eat, cannot talk, cannot move, cannot run, dependent people, elderly, means above 60, retired people and above. And they are in the care home. They are taken care by others because they cannot take care of themselves. And there is a manager, the manager, who is talking to the nursing staff. So, who is talking? Okay, where is he talking? And regarding what is he talking? And with whom he is talking? These are the four things here. Who is talking? With whom is he talking? Where is he talking? About whom he is talking? Somebody is talking to somebody about somebody in some place. Write down these four things which are very, very important. Somebody is talking to somebody about somebody at some place. So four things will be there here. This is called the background or the silhouette or the platform or the scenario. You should know these things. So these will help you what you are going to listen. Because before the beep sound comes, you have to go through, you have time to listen to this. See here, to read each question before you listen. You will have time to read each question before you listen. So listening starts. Before that, there may be 20 seconds. 20 seconds or maybe 15 seconds. There will be a beep sound or something. And before that one, you have to read and understand. Okay? He will tell you. You hear a nurse briefing her colleague about a patient. Okay? And here also it is the same thing is here. Okay? So who is speaking, to whom, and where, about what? So here you see a nurse is speaking to her colleague about a patient, and it is a briefing, means providing information. It is providing information. Okay, now try to understand. So these are the four different things. If you get any one information, that is enough. One bit of information. Now let us see here. So the 4 points are, number one. So to tell you very clearly, number one is the speaker. Okay. Number two is the listener. Number three is, okay, about who? About whom? Okay. And the fourth one is where. So who is the speaker? With whom is he speaking? About whom is he speaking? And where is he speaking? So that is it. Right. Now, these are very, very important. Mind you, These are very, very important. Then he will ask you, what does she warn her colleague about? Now here, warning. One word is warning. That is very important. So you will be ready about what is the warning here. That means something serious is there. Some problem is there. Some damage is going to happen. Some obstacle is going to be there. Some difficulty they are going to face. So be careful, be careful, be careful. Careful of what? Then you will get the answer. Okay. Warning about allergies. Care must be taken to prevent the patients from falling. Warning about falling. Oxygen may be needed if the patient becomes breathlessness. So warning about allergies, warning about falling, warning about breathlessness. So this is about a condition, okay? A condition, medical condition. And this is about a physical condition. This is a helpless condition. This is warning about medical condition, allergic to antibiotics. Warning about falling. Physically he is weak, he may fall down from the bed. Maybe fall down while walking, maybe. This is physical condition. This is medical condition. This is physical condition. Oxygen may be needed if the patient becomes breathless. Okay, this is breathlessness. Okay, these are the three conditions. Warning about what type of condition is he warning? So that is, you have to be very careful. So this word is helping you with these three words. So nurse is briefing her colleague about the patient. That means the nurse knows better and the colleague does not know. The person who has knowledge is telling a person who does not have any idea about the patient. So information flow goes from knowledgeable person to a new person. This is called information flow. So the person who does not know cannot warn. The person who knows can warn. For example, I am a teacher. I know all these things. So I can tell you, I am warning you, be careful because I know what may happen. So a person who does not know, there are many teachers, they say, what? Okay, 1 second. Somebody has some problem. Message me here. Fetsile from Swaziland. Welile Fetsile. Okay. Fetsile, yeah. Hello, Fetsile. Okay, you cannot unmute, I think. Can you unmute? Can you hear me?
Yes.
Can you hear me now?
Yes.
Okay, fine. That's closed. Okay, I'm muting you back. Okay, so here, this is my new student from Swaziland, Africa. She has searched for me and she has joined yesterday for the regular sessions. Okay, right. Now here, you have to know who is speaking, with whom he is speaking, about whom is he speaking, and where they are speaking, and what it is. What does she warn her colleague about? So warning. So this sentence tells about warning. Okay, now here, you hear the manager of a care home. So care home is the scenario, background. And it is for about the elderly patients and talking to the nursing staff. So the manager is talking to the nursing staff in the care home regarding the elderly patients. He says that errors result from errors, mistakes, how they happen. Mistakes, how they happen. He says that errors in dispensing medication to patients usually result from. Why do errors happen? So is it interruptions while calculating dosages? Interruptions while calculating dosages. Somebody is calculating dosages and somebody interrupts in between. So disturbance in between. For example, I'm teaching something and somebody is talking there. So you will make a mistake like that. A failure to check patients' allergies, administering drugs late in the day. So here, try to understand this. Errors, where errors might happen. So calculating dosages. So this is related dosages. A failure to check for patients' allergies. This is allergies. Administering drugs late in the day, drugs. So dosage of drugs. See here very clearly. This is related to dosages. Dosages means how much. Okay. How much? A failure to check for patients' allergies. This is allergies. What? Administering drugs late in the day. When? So, how much, what, and when are the points here. How much dosage you are calculating and somebody is talking and you are disturbed and mistakes happen. Failure to check for patients' allergies. So not checking properly regarding allergies. So allergies is the key word here. Administering drugs late in the day. Administering not important, late not important, day not important. Drugs is the main word. The important word here is drugs. The important word here is allergies. Failure to check patients' allergies. Checking allergies. Failure to check. So main word is, the focal point is allergies. Interruptions not important, calculating not important, dosages. Dosages important, calculating dosages, interruptions while calculating dosages. So dosages, without dosages there is interruptions while calculating. What? Dosages. So dosages is more important here. So which is the most important? Errors regarding dosages, errors regarding allergies, errors regarding drugs. That's it. Okay. Now next time. So you should understand, when you see these things, you can understand. You hear part of a morning briefing on a hospital ward. So this the background is hospital ward, and it is a morning briefing by a senior person to a junior person or a team of members. What is the plan? So it is a plan for the patient today. So that means he's telling today means yesterday there was there, today there is something, tomorrow also will be there. So today is more important. Till now we have given this one. So it was not effective. So we are changing the plan. So this is the plan. So today we will use this. If this does not work, we will see something tomorrow. So what is today? So this is past, present, and future style of question. So this is time frame. Okay. So now you see here her emotional state. So this is a lady. Her emotional state. So lady's emotional state. Emotions. State will be carefully observed. That is not important. That's already a plan. Observing is a part of a plan. What should observe? Observe what? Carefully observe. Carefully what? Observe. Carefully what? Observe. Observe what? State. What state? Emotion. Emotional is more important here. She will be transferred to a more special. So transfer. This unit is not specialized. So we are transferring to a more specialized unit. So transfer. A social worker will come to see what help she needs. So social worker. So plan is observing emotional state, transfer from location to another location, or a person is going to help her. Social worker. So these are the three things. So emotion, mental state, transfer, physical transfer, change, and social worker, external. So mental, physical, and external. Emotional is mental state, Transfer is a physical state and social worker is external. Somebody from outside is supporting. So here, three different things. So plan regarding his mental state, her mental state, or plan regarding his physical state, here not improving, so change his location. Plan regarding we are not able to help, so somebody will come to help. That's it. Please mute. Please mute. Yeah. So here, you should know what you are talking about. And all the regular students who are paid students, registered students, any doubts are there? This is a general class. Any doubts are there? I'll discuss in your individual session. This is a general session. This is 100 times more powerful than personal session. There I'll clear your doubts. No doubt regarding that. So here, let us see here. You hear a part of an antenatal consultation. So this is a consultation. And the scenario is GP practice, general practitioner's practice. And antenatal, prenatal, antenatal, postnatal. So you should know the meaning of antenatal, postnatal, prenatal, or whatever these natals. You should know the word. Now, antenatal, postnatal, antenatal. Anti means what? Going back. So, now you can see here, if you don't know the word also, you can understand here. The advisability of a home birth. The birth is not done. That means this is before birth. Before birth. Neonatal means new birth. Postnatal means of birth. Okay. So now here, he is talking, you hear a part of an antenatal consultation at a GP practice. So GP is talking to a patient, mother, okay, before giving birth. What does the patient want to know about? So knowledge, she is seeking knowledge. She wants information. Information regarding what? Advisability, advice regarding home birth. Is it regarding home birth? Ways of avoiding postnatal depression. Is it regarding depression? Postnatal depression means after birth there will be depression. So that depression. Or what painkillers? Is it real painkillers? So this is before birth, this is after birth, this is during birth. Pre-birth, post-birth, this is while birth. Do you understand now? Every question has a different strategy. Now I told you here, in the previous question, this is mental. So you should understand what nonsense he is talking. This is physical. This is external. Oh. First one is mental. Second one is physical. Third one is external. So this is about emotional state is mental. Transferring from one place to another, that is physical, motion, movement. And this is social worker. This is not related to him at all. These two are personal. These are external. So first one is mental, second one is physical. So this is different style of question. Okay, you should understand what it is talking about. Emotional, transfer, social worker. There you can understand this is mental, this is physical, this is external. That's all. This is mental condition, this is physical condition, this is a helpless condition where he cannot do for himself. This is he can do for himself, this is he can do for himself. The hospital people can do, but this is somebody else has to do. Now here, this is regarding medication, which the doctors give. So this is, okay, this is amount. This is amount, okay. This is the problem, okay, right? This is the thing. This is the thing. This is the medication. And this is the amount of medication. So you see that is quantity. Okay, this is the problem. First one is solution, third one is solution, second one is problem. Okay. First one is how much of the solution. Second one is what type of solution. Third one is what type of solution. Second one is what type of problem. Dosage is amount of solution, amount of medication, amount of drug. Last one is drug itself. Okay. So here you should understand what type of question it is talking. And here you see, this is another type of question. This is before birth. This is after birth. This is while birth. So first one is before birth, advisability of a home birth. That means she should go and stay at home only. Home birth. So pre. And this is postnatal, this after. Postnatal depression, after birth. And this is during labor, means while delivery. This is before delivery, this is after delivery, and this is while delivery. Try to understand how he is differentiating the questions. So she's asking about the problems before, or the problems after, or the problems during. So try to understand. If the labor is fine, she will go and home and do everything at home only. Otherwise, she will stay in the hospital itself. And how to deal depression after birth, there will be many problems. Many problems will be there. Mental problems, physical problems, personal problems, emotional problems. All type of problems are there. Because of that, she may fall into depression post-delivery. Then this one is during delivery. Painkillers might be available during. So before, after, while. So you should see that one. This is antenatal consultation. She's asking about. Okay. So this is how. Next one is, you hear a doctor talking to a teenage boy who has a painful wrist. I'll give you a chance in the question answer session, please. I'll give you a chance to speak in the question answer session. Please put your hand down. Thank you. God bless you. So because I'm in a serious point, I cannot come out of that one. Afterwards, I'll explain everything. Thank you. Right. So you hear a doctor talking to a teenage boy who has a painful wrist. So now you can see here very carefully. This is a doctor. So he's talking to a teenage boy, and the boy has a painful wrist, about a painful wrist. A doctor is talking to a teenage boy regarding a painful wrist. So doctor wants to establish, confirm what? He wants to confirm a fracture may be misaligned. He's talking about fracture. The swelling may be due to a sprain. Is it a sprain? Or there may be more than one bone affected. So see here very carefully, more than one. A fracture may be misaligned. A fracture may be misaligned. This is more than one bone. This is single, this is more than one. And this is not at all. So you should know here. So this is one. This is none. This is more. One or more or none. That is the concept here. One bone is fracture, misaligned, or the swelling is not at all a fracture, not at all bone affected, it's just a sprain. And more than one bone. One bone, A. More than one bone, C. 0, that is B. That's all. Here is the 90% of the answer. Why are you looking madly at the audio? There are many people who see why they are not starting the audio as if they are masters without studying from here. They want to go directly there. 90% of the answer is here only. Crazy people. Sir, listening is difficult, sir. Reading is difficult, sir. What nonsense difficult? So simple as that. He wants to establish how many bones affected. 0 bones, 1 bone, or 2 bones or more. 1 or 0 or more than 1. That is simple as it is, just a number. He wants to establish how many bones are affected. First one is 1. A fracture for bone may be misaligned. That's 1. The swelling may be due to a sprain, not a bone fracture. There may be more than 1. So 1 or more or none. It's a number question, based on number. He wants to confirm. He wants to standardize. He wants to establish. He wants to diagnose perfectly. Establish means that is it. Here itself answer is there. Close your eyes and just listen afterwards. When the audio is playing, just shut your eyes. Because everything is there in your brains. There are many students who pay the fees but don't attend the sessions. Why? They think that this is all nonsense. Just because nobody is teaching, it doesn't mean that this is all nonsense. Right. So simple as that. Try to understand the questions. And here, question number 29. You hear a trainee doctor means junior, telling his supervisor about a problem he had carrying out a procedure. So he did a procedure. During that procedure, he had a problem. So this training doctor who had this problem in carrying out this procedure is informing his supervisor about the problem. And he's talking, the trainee feels the cause. He's telling, he feels that the cause of the problem was. He feels. What is the cause of the problem? What is the cause of the problem? Now see here very carefully. He's telling you very carefully. 1 second. He's telling very carefully. Previous treatment. Treatment administered previously. The patient's negative reaction. Patient. The problem is the patient here. The problem is the treatment here. The problem is the equipment here. Now see here. Why he was carrying a procedure, he had a problem and he's telling the problem to his supervisor because he's a trainee doctor, not a specialist doctor. He's giving an explanation why it may be happening, why it might have happened. The cause of the problem was the previous treatment. Treatment is the problem. Earlier treatment is making a problem now. The patient's negative reaction. This is person. This is equipment. This is the procedure. This is the person. And this is the material. So these are the 3 different things. Don't you understand there? Why can't you differentiate? You are thinking, what is the answer? What is the answer? What is the nothing is the answer. Answer is here in front of you. Answer is the procedure which happened earlier, which was given earlier, or the patient himself, the person, or the instrument, or the equipment, or the machinery. First one is the procedure, the treatment. That means the doctor's problem. Second one is the patient's problem. Third one is the machinery problem. Previous doctor's problem. So he gave wrong treatment. So that is making problem now. The patient is a problem here. He has a negative reaction. He's scared and he's moving and he's crying in agony and paining and is something patient's negative reaction. Third one is the equipment. You should understand what he is talking about. Sir, explain this answer, explain this answer, explain this. What explain this answer? Everything is here. You are a graduate, you are a postgraduate, you are a doctor, you are a nurse, you are a podiatrist, a lot of professions you are. You belong to special medical fields. These small things you can't understand. Even a 10th class student can understand. Why do you prove feeble? Because your approach is wrong. You are thinking answer will come from the audio. No. Answer will only be confirmed from the audio. Answer is there in your mind here. Procedure or person or instrument. That's all. Close your eyes and you will get it. Focus. So that is it. Focus, attention, concentration, techniques, strategies. Focus, attention, and concentration, all are same. No, they are not same. They are not same. They have different meaning. That's why 3 different words. They are synonyms. They are not meanings. So if they are same words, why 3 different words? No. Techniques, strategies, approaches. So what you have to do is focus on the question. Why he is not playing the audio and giving you the question, and is he a fool? Is he mad? OET is not mad. OET is not mad. He is telling you, you will have time to read each question before you listen. Before you listen, you will have time to read each question. What do you mean by read each question? Like a LKG boy, you have to read this? No. You have to study like a PhD candidate. Like a research scholar, you have to read this question. Read between the lines what he is talking. I told you a lot of relationships here. Okay. So, now see here. Here, the first part. The patient is allergic to some. So, this is the problem with the patient. Okay. Right. Care must be taken to prevent the patient from falling. This is the nurse part. Okay. Oxygen must be needed. This is neither the patient nor the nurse. This is intermediary. So what is required? Oxygen. So this is patient, this is nurse, and this is oxygen. So the patient is allergic to some type of. The patient is allergic to some types of antibiotics. Care must be taken to prevent the patient from falling. Oxygen may be needed if patient becomes breathless. First one is allergy to antibiotics. Antibiotics. Care must be taken to prevent the patient from falling. Physical condition. This is a medical condition. This is a physical condition. Oxygen may be needed if the patient becomes breathless. Emergency. So you can see in the another direction now here. So first one, I am pushing it here. And I am giving another one here. The first one is, this is medical condition. Second one is physical condition, helplessness. Third one is emergency condition. Medical, physical, and emergency, 3 conditions here. Okay. So you have to analyze what he's talking about. So everything we have seen. See, this is mental, physical, and external. This is medical, physical, and emergency. This is amount and problem and medication. This is before, after, and while. the problems, worried regarding before things or after things or while things. And this is procedure or person or instrument. And this is one or none or more. That's it. Yeah. Okay. So this is one man show. I told you I'm a military commander. I'm least bothered. I know what I'm doing. Cambridge University has given me a certificate. I know what I'm doing. Perfectly right. Okay. Soldiers have many doubts. They'll say, sir, what should I do? What should I do? I'll do like this. I'll do. No, follow my orders. That's all. Why? That is why he has, from a soldier level to a commander level, he went. Okay. He knows everything. That's why he will tell everything. Be careful. Be ready for all these things. Be ready for all these things. Then it will be easy for you. Now I am unmuting. Don't unmute anybody until I call you the name. By name, don't unmute. Only when I tell you unmute, then you unmute. If you are not able to unmute, leave it. Dr. Adil Zaidi from Pakistan. Hello, Dr. Adil.
Hello, sir.
Yeah, hello, dear. How are you?
I am fine, sir, now.
Am I talking sense or am I giving nonsense information?
No, you are talking sense, absolutely.
Okay. What is the difference I created for you? You are a doctor. So definitely your answers will be beneficial for the others who are nurses. You tell me, please.
I haven't heard the video, audio.
Why? What happened? Now audio is not there? No, I did not play the audio. I'm just giving you how to analyze the question. Huh?
Yes. So
whatever I explained, was it useful or not? Will it help you to identify the answer or not?
Yes, of course it will help.
You are otherwise you have to listen to everything. Now you need to listen to only 3 things, na?
Yes.
You know which is the answer. There are 3 answers. 3 balls are coming. Which ball will come? That ball will you catch? That's all, no?
Yes.
Otherwise, every ball is a ball. Every second you are scared of ball. If you are blind, no?
Yes, you are right.
If you are blind, when the ball is coming, you don't know. Every second you will be searching for the ball, because you are blind. Earlier you are blind. Now you are wise. Your your third eye has been opened now. Wisdom eye has opened. So now you need not struggle. You know there are only 3 balls now coming from 3 different sides. Which ball comes from where, you know? When it comes, immediately you will catch. That's all, right?
Yes, you are right.
So earlier you are nowhere. At least you are somewhere now. 3 words are there. Right. So tell me, what was the benefit for this session which I have given now?
At least I have a clue how to approach the exam, how to approach the question.
Yeah, that's fine. That's fine. Amen. Amen. Amen, Faith. Okay. Priya Thomas after a long time. Hello, Priya. Was that useful? Okay. Ranjita Das. Yeah, Srilata, was that useful? Okay.
Yes, sir.
Yeah, Ranjita, share your experience. Was it useful?
Yes, sir, definitely. It is very beneficial.
You may be you people may be thinking for 1 hour sir was teaching something he was
no,
teaching.
Sir, no, sir.
He is not opening us to talk. He is not allowing us to give doubts, explain doubts. So he is just going on teaching because too many cooks spoil the broth. That's it.
Yes.
Okay. So
yes,
there is one shepherd leading everywhere. Just they follow, everything will be safe. Correct?
Yes.
So if any doubts are there, that we can deal with personal session, no problem. So what benefit did you get from this session? Can you tell me?
Yes, sir, definitely. It is very useful. If I the keyword, if I find out the keyword, especially in all the sentences, not cover the all sentence, only keyword. If I find it, then it is very easy to after listening the thing, we catch out the main thing.
Very good. Okay, thank you. Anybody who wants to share your experience? because I call you and you don't answer. I feel sad, you know. So that's why if anybody wants to speak now, yeah, somebody was raising hands. Who was that? Simi or Semi? I don't remember. Simi George, I think. Yeah. Hello, Simi. You can unmute now. You can ask your question, please. I'm sorry, I could not give you time that time. But if you have any doubts, you can ask me now. And then Uppula. Hello, Srilata.
Hello, sir. Good evening, sir.
And this is what I like. When I say some name, immediately they open their button and speak. That is what I like. Okay, fine. Because I feel that you are my children, but you just say silent. I don't know what is this relation between teacher and student. I don't know. When a teacher says name, yes, sir. Like that it should be. Like a military commander. Okay. So shoot means shoot. That's all. Right. Yes, Srilata, share your experience. What did you learn from today's session?
So this the second part of it is really sometimes very tough. But now you have given us the key points how to locate the answers, and I think really this will be helpful for me.
Yes, this is like sharpening
Also
the
very good in
axe before
identify.
cutting the tree.
Yeah. Absolutely, sir. It is really very beneficial.
People directly, they want some wood, they'll take an axe and go to the tree and start chopping. If you sit down and sharpen for 15 minutes, the difficulty, instead of 1 hour, you will finish it in 15 minutes.
Really, sir. Really, the key points are very much noticeable. All this while, maybe I was listening to the whole audio. Then I was trying to find out the answer. But then now this really the striking points will really make me effective to find out the answers.
Yeah, now I'm going to play the audio. So you can do the answers now. And I will give you the option. Anybody else? If you want to ask questions, you can ask now. Now this is question answer session. Anybody has any doubts, you can ask me right now. 10 seconds more. You can unmute and you can ask. New candidates. Yeah, Manali Patel. Yeah.
Yes, sir.
Manali, do you want to share something?
No, sir.
Okay, was it beneficial for you?
Just now I
Okay, you just
joined.
now you came. Okay, fine. You can mute back. Okay, fine. So let's see here. So welcome. Some special candidates are there here. Some guests. Okay, some old memories are there. So fine.
Excuse me,
Yes,
sir.
Mitha.
Yes.
You can, Mitha. Yeah. Do you want to say anything?
Yes. I just hear last one question only. Yeah, I want to ask whether this video is posting into YouTube or not.
Yeah, normally I don't post most videos on the YouTube because these are personal sessions for paid students, regular students. Okay. So what you can do is this video is already posted in the YouTube. Okay, you can take it from there. Very good. You asked that question. You have that intention to learn something. Yeah, it is posted there already. Okay.
Yes, and one more thing, sir.
Yeah.
Like C part also, can you give some tips and all?
I don't know when I'll give, but for the personal sessions, in the personal sessions and individual sessions, in the regular student sessions, I'll give normally. This is an open session. So maybe it will come, C part may come maybe after 15 days or 20 days. I don't know. Once in a week, I give open sessions.
Okay, fine. Thank you, sir.
So if at all I'm giving open sessions, it will be there in the Telegram channel. You can join from there.
Yeah, sure, sir. Thank you.
Okay, because in my regular sessions, I take only 7 students and only those 7 students will be there. Okay, right. So definitely I appreciate your interest. Fine. Now coming to the point, all of you mute back. Okay, let me mute all of you back. So now I'm playing the audio. Take your notebook and write in your notebook. Take your notebook and write in your notebook all your answers now. So I'll be playing these things. Okay, playing the audio from here. Okay, right. I'll keep it from here. Okay, that would be better. Okay, Right. 160. 160. Okay, so this is it. The screen is in front of you. I'll be playing the audio now. In. Huh? Chinna, who told you no? Whatever you want to order, you do one thing. I need 1 second. Sorry, please. నాకేంటి అని అంటే డ్రమ్ స్టిక్స్ ఏమైనా ఉంటే తెప్పి నోరు తినాలనిపిస్తుంది. నాకు ఎనర్జీ తక్కువ అయింది. నాకు ఎంత మంచిగా తింటే అంత మంచిది. షవర్మా అమ్మేమో షవర్మా అది బాగుంటుంది. ఓకే, నువ్వు ఏదో ఒకటి చెప్పు. గెట్స్ వాట్ ఎవర్ యూ వాంట్, బట్ ఐ వాంట్ సంథింగ్ స్ట్రాంగ్. ఓకే, బాడీ ఈస్ వెరీ పెయిన్ఫుల్. నిజంగా మస్తు వస్తుంది, బ్యాక్ అంతా నొప్పిలేస్తుంది. So sorry. Okay, I'm sorry because today is third day. Day before yesterday I got the report. Not day before yesterday. Yesterday only I got the report. So I did not think that I survived the difficult days, but now when everything became normal, I faced this problem, and my entire family got affected, and every one of us are quarantined. Okay, so because these students, some students are going for the exam, I have taken this session. Otherwise I would have taken excuse for today also, but no problem. Okay, right. So where am I? Yeah, I said I will play the audio. Yeah, here it is. Oh my God. Please remember us in your prayers. Nothing is going to happen, but still, please remember our family in your prayers. We need today Thomas Bitty. She's going to UK. Very good. Wow. Wonderful. She was actually crying like anything. She was crying like anything in happiness when she got the results. Okay. Immigration, UK, visas and immigration. She got visa. So through our agency, she is going. She has sent it just now. This is her results. I'm very happy when students get the results. So that is it. These are her results. Okay, Bitty Thomas. All B's. She just joined for 1 week. She just joined for 1 week or 10 days, suppose. No, 15 days, sorry. 15 days. She was literally crying. Okay. I told her just pay 5,000 rupees. She paid 5,000 rupees, but when she got the result, she said, "Sir, you have blessed me like anything." Literally, her mother talked to me. She said, "This life is set, sir." Okay. And she was very, very happy. And she sent me a gift. Her mother sent me a gift of 10,000 rupees. She said, "Sir, this is my gift to you, sir." Okay. So, and this is the result. The visa has come here. Babu, here it is already. Yeah. Yeah, this is her visa. So, certificate of sponsorship details. That's it. So, she is from Trivandrum, Pathinamthitta, Adur. Okay. Just now, few days back, she called London. Okay. She was very happy. Will be very happy when you get these results. Okay. Only the thing is, you have to trust and you have to listen. How are you, sir? How is your health? Thank you. Remember me in your prayers. Okay. Now, this is OET listening test 1. OET listening test 1. Thank you, Javant. So this is listening test 1. Okay, listening test 2-1. I will not stop the audio. I'll be playing it continuously. Okay. This is, where is it? Part B is here. Okay. So part B.
Occupational English Test. Sample Test 1.
Come in. It's Mr. Sands, isn't it?
That's right, Ray Sands.
Now, I think
Extract 2. Questions 13 to 24. You hear a consultant dermatologist talking to a patient. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay.
Write your answer in your notebook. Don't write
Question
anywhere.
26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning than afternoons or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure.
We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilisation of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay. I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We will consider that at tomorrow's ward round.
Question 28. You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anaesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Question 29. You hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. Now read the question.
So how's today gone, Harry?
Well, I'm afraid I had a problem taking blood from Mrs. Harris. I've done that procedure numerous times now, so I wasn't particularly worried. What I hadn't anticipated was the difficulty finding a vein. I suspect her illness means she'll have had a number of cannulas inserted over the weeks she's been here, and that's led to collapsed veins.
Well, that can happen with long-term elderly patients, and it's distressing for them if the procedure isn't done quickly.
Oh, she endured it without a murmur. I'm sure I would have made a fuss in similar circumstances.
Well, I'll supervise you the next time you do it.
Question 30. You hear a doctor talking to a teenage boy who has a painful wrist. Now read the question.
Now then, I understand you fell off your skateboard some days ago and injured your wrist. Is that right?
Yes, I slipped and put my hand out to save myself. My mum says I've sprained it.
You certainly got some swelling and bruising there. But I don't think your mum's right in this case. Does your wrist hurt?
It aches, but the pain's worse when I try to grip something.
Right. Well, I suspect you've broken what's called your scaphoid bone. It's a classic injury resulting from what you describe. I can't feel any other fractures. But you'll need an X-ray to see where the two ends of the bone are. If they're not meeting up properly, you'll need an operation to sort that out. But let's see the results first.
Okay.
So there you are. Having done this, now we'll check your answers. So let us see. Right. And now what you do is, I'm opening the chat box on the right side. So here is the chat box so that I can see your answers here. I think it will be black for you, but still. Okay. Now here, question 25. Question 25. So submit your, when I say submit, then only you submit. Until then you wait. Don't submit. I'll count down. 5, 4, 3, 2, 1, submit. Okay. Very good. Fast, all of you, active people. We don't have any space for lazy people, all active people. Come on. Yeah. So let me give a clue for this answer. The answer will be yeah. I'm going to show you the answer now. So part A, 24. So part B. Yes, we are coming to part B and the question number 25. 25 is coming up, part B questions. 25 is B. The right answer is B. The right, if your answer is right, put a tick in your answer. The right, afterwards you have to submit your answers. You have to send me in the, I'm going to select some students who are really serious. Write your name on the paper, take a photo of that one and send it to me. And I will give you part C class, even if they are newcomers. I will arrange a session for you people who are serious. Only for those students who send me the picture of these 6 questions with their marks and the name. Right. The right answer is, okay, B. B is the right answer. Fine. B is the right answer. Okay, fine. Right. Now it's 25 over. Now 26. So question, type and keep your answer ready, but don't submit until I tell you. Question number 26. Type and keep it. When I say submit, immediately you can submit. 7, 6, 5, 4, 3, 2, 1, and submit. That's it. Come on, come on. Come on, come on. Okay. Now let us check the answer. 26 is A. The right answer is A. Okay. The answer. The answer. A is the right answer. Fine. So tick your answer sheet wherever it is. Then next one. Twenty-seven is here. Question number 27. Question number 27. Okay. 7, 6, 5, 4, 3, 2, 1, and submit. Okay. The answer. Okay. So here, let us see what is the answer. A is the right answer. A is the right answer. A is the right answer. Okay, fine. That's really good. The next. (28). Question number 28. Seven, 6, 5, 4, 3, 2, 1. Submit. Yes. Question number 28. 28. Okay, there you are. So, see the right answer. C is the right answer. Next one. Question number 29. Seven, 6, 5, 4, 3, 2, 1, and submit. Okay. Now let us check the answer. Number 29. That is, okay. A, the right choice. Fine. Question number 30. Submit your response. 7, 6, 5, 4, 3, 2, 1, and submit. Okay. The answer 30 is A. A is the right answer. So total marks, score, please. 6. Okay. How many marks out of how many questions? How many marks out of how many questions? If it is 4 by 6 or 5 by 6 or whatever it is. So he told bone, B-O-N-E, bone. But maybe the 2 joints, but not 2 bones. That is the confusion. When they say 2, immediately more than 1 they will think. No, 2 joints, not bones. Okay, that is it. 2 joints, not alignment proper. That is the point. Okay, that is what you have to be very careful. He may say 2, but that is a trap. That is a confusion. That is a confusion. So you have to be very careful. Those are the 6 questions. BAACAA. Okay, fine. Now, so Achu is here. Okay, right. Provide your feedback. What is the difference? What difference did this lecture? What difference did this lecture okay, did this lecture make in your learning? Okay. Yes, what difference did this lecture make in your learning? Yes, you can write down 1 or 2 sentences, whatever it is, you can write down. In the meantime, yeah, anybody has any questions, you can ask. Yeah, this is Raji Sanu. Raji Sanu. Yeah, Raji, you can unmute. 1 second, I'm unmuting everyone. Okay. Yeah, Raji Sanu, you can unmute. Raji Sanu, you have raised your hand. You want to say something?
I unmute already, sir.
Yeah. Yes, please. Okay. Anybody has anything to say, you can speak. Okay. Ranjita. Hello, Ranjita.
Yes, sir.
Yeah, this is my regular student from Kolkata. Hello, Ranjita. How are you?
I'm fine, sir. How are you,
Yeah,
sir?
I'm fine. I'm fine. I cannot say I'm fine exactly,
Yes,
but I'm
sir.
trying.
Yes, sir.
I'm trying to pretend being fine. Okay,
Yeah,
because
yes, sir.
I'm fighting my people also. They told don't take classes for 2 days, but I said no, I cannot. 1 day is too much. Okay. Yeah, at least evening I have to take a class. That's the situation. Okay. Right. Yeah, tell me, what did you learn today? And where is Aditi? Aditi is there or not?
Actually, her daughter having problems. That's why she couldn't attend the class, I think.
Okay,
I
okay, no
told
problem.
her that today is class. Yes, sir.
Okay,
Some family
no
issues,
problem.
sir.
No problem. She can watch from the YouTube. No problem. Today's session.
Yes, sir. Yes,
Yeah,
sir.
tell me what difference did this lecture make in your learning styles?
So many things today I'm learning, sir. First thing is the keyword. I don't know before that thing. I'm listening, but I just practicing, but I don't know the process, how to collect the main thing. And then if I lines after the listing, but when it is easy to find out what is the answer is behind this. So
Okay,
today I learned about this thing.
fine. That's good. That's good.
Yes, sir.
Anybody else? Jayvant is also very open. Yeah, Jayvant, you can unmute. Jayvant. Where are you
Hello,
from,
sir.
Jayvant?
Good evening. I am
Good
from
evening.
Indore, sir.
You are from Indore. Indore is
Yes,
near
sir.
to Jaipur. Eh?
No,
In
no,
which
sir.
state?
That is in the Madhya Pradesh,
Hmm.
MP.
You are in
I am in Indore right now.
Indore, which state?
That is the Madhya Pradesh, sir, MP.
Okay, okay. Yeah, share your experience. How did you benefit? What was the benefit you got here? How was it
Yes, sir.
beneficial for you?
Yes, sir. I haven't attended the full session, sir, but whatever you told in the last time, that I got in my mind, and I am using that strategy for giving the answers for that. So I got 4 out of 6 out of there.
Okay.
And thank you so much, sir, for these lessons you are giving to us. It is very helpful. Whenever I'm watching in your channel, there is any classes, then I'm continuously joining the classes for my learning. Thank you so much, sir.
You're welcome. Welcome. Sanjana. Hello, Sanjana. How are you? This is another new student who registered recently, just for 21 days. She's a very excellent student. She's very obedient. And I told her, don't do any work. A full day, you be with me from morning till night. She will be. Yes or no, Sanjana? I trouble you too much, right?
Yes, sir. It was very helpful, sir.
I trouble you too much. No, morning to evening, I make you do something or the other thing, right?
Yes, sir.
Huh? I trouble
Yes,
you
sir.
too
I'm
much.
doing
No?
everything.
Am I troubling you?
No, sir. No, sir.
You're happy doing all these things.
Yeah, I'm very happy to do all the things that you are suggesting.
Very good, very good. Excellent, excellent. I really like your style. When I say write 4 letters, you write 4 letters. When I say write 3 letters, you'll write. When I tell do 6 speaking sessions, you'll do 6 speaking sessions. I'm really very much pleased to have students like you. Okay. Not only students need excellent teachers, teachers also need excellent students. Otherwise, the interest will be lost. Huh? Okay. So, right. That's really very fine. Okay. And afterwards, you call me. I have a favor request for you. Okay. Then, yeah. So, what is that? Is that new student is there? Velile. Fetsile. Is she here? Fetsi. Fetsi from Swaziland. Okay. Right. Yeah, Srilata, what did you learn today? How many marks you got?
Sir, I got 5.
Very good.
It was an excellent explanation because your explanation has given us the path to find out the correct answers. But I was, for the 6th question, I was a little confused because, as you said, it is bone.
I should not give you microphone first of all because you'll bloat me like a balloon. I don't want that.
No,
So
sir.
next time I will not ask you anything. Okay, leave it.
Sir,
I
whichever
asked
is
the
the
wrong
truth.
person.
Whatever is the truth, I've said, sir.
Okay, fine, fine.
The only question
The truth is a little bit something bitter for me. What to do? Hello, Raji. Was that useful for you, Raji? What explanation you heard afterwards?
Hi, sir. This is Raji.
Raji. Hello.
Hello. Sir, today my learning experience is the
I think
keyword
you are
very
something below 25 years of age. I think maybe 22 or 21, maybe even that. Am I correct?
No, sir, I am 38.
You are 38, but your voice is so. I feel that you are just like from the college. You have come out like that. I felt. Okay. Okay.
No,
Fine.
sir.
Fine.
No,
Tell
sir.
me. Yeah. What was your experience? Tell me.
My learning experience is the main keyword, sir, because the keyword leads to find out the correct answer. So
Okay.
it's a very much beneficial. It's really helpful for me.
Very good. So I'm giving an opening. So tomorrow, day after tomorrow, 3-4 students are going for exam. So 4 vacancies are there because I don't take too many students. Last time I told 3 people, I took 3 people. Okay. So now 4 vacancies are coming up. 2 doctors and 2 nurses. So 4 openings are coming up. If anybody is interested for a full-time course or a month course or a crash course, whatever it is, or if you want only writing or speaking corrections, only opening is there for 4 students. And you can contact me personally. I'll give you my WhatsApp number. So I'll give you my WhatsApp number here. You can contact me on my WhatsApp so that I can respond to you. Otherwise, no openings afterwards. So my seats, before they go for the exam, my seats get filled automatically. Many people, they ask me, they request me, and they'll take my seats. Okay. So like that one, I won't advertise much. I don't call anything. Whenever there is a place, I take 7 students per batch. When the batch goes, for example, 4 students or 5 students, when they get go for the exam, then I'll take. So 2 doctors, 1 Dr. Walid and 1 Dr. Azharuddin, and 2 nurses are going for the exam. So in those places, I'm going to recruit. So if anybody is interested, you can contact me. There is no compulsion. because I get my students, because God provides me. I need not beg or ask for students. So God provides me. So that is not a big problem for me. So if you are really interested and if you are really dedicated and serious and hardworking, then only dare to call me. Otherwise, please don't contact me for admission. So this is my WhatsApp. .me. I am only rejecting. Even before you come, I am rejecting those students who are not serious, who are not interested, who are not dedicated, who want to work more than study. They want more work more than study, because money is coming. They want to take care of family. They wanted to take care of work. Study is study, study is study. That's all. You cannot do two things at one time. So WhatsApp.me is here. So that is WhatsApp.me. I don't know why it did not come. Yeah, here it is. Copy link. Yeah, this is the link. So WhatsApp.me. If you click on that, you will directly go there. You can send a message to me. If you are really serious, please come to me, because I don't have time to waste on people who just want to play around. I don't mind. I don't want. Okay. There are many students who join with me. They don't give me proper time. They don't study properly, and they will do multiple things: work, family, other thing, all other things. Then last, study. That's all. If they don't give me, I don't need. There are many people who can teach you. You can go to them. But if you are really serious, if you want to give me time, okay. Otherwise, you can take 3 months time and prepare well, and then go for the exam. Then you come. So contact me if you have any requests or favors. 4 places are there. So you can contact me for that. And last is there Chitra Kalyana Sundaram. How are you? Hello, Chitra. Oh, amen. I did not ask amen. Yeah, Chitra, how are you?
Fine, sir.
Did you attend the full session, or you came just now?
No, sir, I attend the full section.
Okay. Did you understand the techniques and styles?
Yes, sir, I understand, sir.
So was that useful for you?
Yes, sir, benefit, more useful
Okay.
also, sir.
Okay, fine. Yeah, others are not
Thank you,
responding.
sir.
So let me see. Soumya,
Thank you, sir.
Stella Maris. Hello, Stella Maris. I think this is the second time I'm talking to you. Hello, Stella. Okay, Amruta Dev. Yeah, Stella. Yeah, how are you, Stella? Earlier also we talked, no? One time like this. Okay, some problem with your microphone. Okay, no worries. You can type in your WhatsApp chat otherwise. Yeah, hello, Stella. Tell me.
Okay.
Yeah, we have a problem. Okay, no problem. Your message. Okay. Next, Amen. Amen, Faith.
Yes, sir.
Yeah, Amen. When is your
Yes,
exam,
sir.
Amen?
Sir, 19th February, sir.
19th February. Okay,
Yes,
so fine.
1
So
month
are
is
you
there,
getting
sir.
so you paid 6,000 for reading and listening. Are you getting the quality you want or not? You told that there are some teachers you have already registered with some famous institute, and they told you nobody can teach you reading and listening. You have to do it on your own. Is that correct?
Yeah. Yes, sir.
Is that correct? Nobody can
Yes,
teach you
sir.
reading and listening.
No. They told me like that. Yes, no one can teach listening and reading. But the thing is, yes, there is a strategy we needed, and you taught me how to do reading. Actually, day by day, I am improving. Before that, I was getting below 20. Nowadays, I am getting 27, 28.
There will be one day when you will get 39, 38, 40 also. Okay.
Yes, sir.
And if you get 42 out of 42, then I'll take a photo with you.
Definitely.
We'll take a photo together and say, this is my favorite student, I'll say. So here, 66256. This is Manali Patel. Manali Patel sent the photo. This is the photo. Very good, Manali Patel. Very good. Excellent. Then next one is another person also sent. Who is this? This is name Reshma. Reshma or Jishna? Yes. I don't know what name it is. Some Jishna. Yes. Okay. Right. Then another person also. Hi, sir. Okay. Bye, sir. Okay. So where is the photo? I am waiting for the photo. Come on. So this is it. Right. Very good. Right. So that's the end of the session. I'll see. Now I'll have my dinner. Then if my everything is okay, my energies are full, then I'll take a reading session. Otherwise, tomorrow. I want to take, because I'm feeling bored sitting silently. So Jayvant, okay, I am interested. Okay. Upula Srilata, how many? 5 out of 6. Very good. Good. Yeah. So all the answers are here. Okay, select all, copy, and then go to Telegram session, Telegram channel. Okay, post it here. Yeah. I posted all your answers, responses, and everything. Yeah. So somebody from Saudi is interested to join. Okay. So 4 places are there. You can contact me. So, and I appreciate your attention. Yeah, Reshma, I think. Reshma. Send the picture. Okay. Soumya. Hello, Soumya. Reshma.
Hello, sir.
Yeah, Soumya. This is Soumya Binoy or Vijay, or who is this Soumya?
Soumya Shiju.
Soumya Siju. Do I know you, Soumya Siju?
No, sir. This is the first time.
This is the first time. Okay. Are you there in one of my groups, or you came from Telegram channel?
No, I am a member of WhatsApp group.
Okay.
Today.
Are you attending the speaking sessions in all the groups?
No, sir. I hear only your writing correction class. Then I
Okay. You
interested.
message me. I have WhatsApp groups. You message me WhatsApp and say, I
I
want to
messaged already to
practice.
you now. I'm interested. That's why.
Okay. Then you will be in the special group then.
Okay. I will contact you.
Special group.
soon,
Special
sir.
group means regular sessions will be there. Everyday sessions will be there.
Okay,
For
sir. I will
ordinary,
contact you soon,
weekly
sir.
1 day only, because they are paying the fees. No, they will kill me otherwise, and it is not right. So individual personal attention I will give them. Okay, those who are regular. Okay,
Yeah,
next.
yeah.
Fine. Thank you.
Sir,
So this
thanks.
is Soumya, right?
Yes, sir.
Yeah, let me make a note of you. Then Reshma, how are you, Reshma?
Hi,
How do
sir.
you-
Fine,
how do
sir.
you
How
feel
are
the
you?
session? Where are you from, Reshma?
Sir, I'm from Saudi.
You are also from Saudi. All Saudi people have no work. They will be awake till 10 o'clock in the night. Here, Indians, they don't want to study in the evening. I'm a Saudi teacher only. Because, all Indians, they have teachers here. They study in the daytime. Only in the night time, I'd like to teach, because nobody will be there. No disturbance will be there. And all Saudi people will come. So this name, what is that name? Soumya, she told. Soumya from Saudi, right?
No, sir. Kuwait.
Kuwait. Okay, Kuwait. Rich people, these are all sheikhs.
No, sir.
Right, okay. Then Achu.
Yes, sir.
Hello,
Good
Achu.
evening,
Where
sir.
are you from?
Sir, I am from Kerala.
You are from Kerala, but Kuwait, huh?
No, sir.
You are
I am
only from
still at
Kerala. Then
Kerala.
okay. You are Indian people. These are foreigners. We have to be away from foreigners. So fine. We'll become friends, okay? We are Indians.
Okay, sir. Thank you, sir.
Okay, tell me, what did you learn today, Achu?
Sir, I attended the class in the middle. Just I attended the listening test, but in the middle only I attended the class. So
Okay. You missed the lecture part a bit.
I missed the lecture part.
Okay.
But I think I can watch it in the YouTube.
Yeah, you can watch it in the YouTube. I'll give you the link also for the YouTube.
Okay, sir. Thank you, sir.
Yeah, definitely. You send me a message in WhatsApp. I'll send you the link in all the groups. Are you attending any speaking sessions in the groups?
Yes, sir. Today I joined the group, WhatsApp group for speaking.
There are 5 speaking groups.
I
And my
joined
group is special group. 6 groups are there. So those who
yes,
do
sir.
speaking sessions in all the 5 groups, I'll give 1 speaking. But for regular students, I'll give 2 or 3 speaking sessions.
Okay, sir. Okay,
2
sir.
or 3 speaking sessions I'll give for the regular students. Okay, fine.
Okay, sir.
Right. Very good. Any new other students? Soumya finished. Reshma. Hello, Reshma. Last candidate. Okay.
Hi, sir.
Yeah, Reshma, did you enjoy the session?
Yes, really enjoyed, sir. Very excellent class.
Very excellent. Your voice is cheating, huh? Your voice is cheating like a schoolgirl you are talking. Okay, fine. Very good. God has blessed you with a wonderful voice. Right. So have a nice day, all of you, blessed people. And there was only one boy. Okay, I am alone. Jayvant. Hello, Jayvant. You are my darling today.
Yes, sir. Good evening, sir.
In all these girls, I will be nowhere. So at least somebody should be there, no, with me.
Yes, sir. Always with you, sir.
Okay, dear. Okay, very good. You can all invite your friends into the groups, WhatsApp groups. You can ask me to give me the link, give you the
Yes,
link.
sir. Yes,
Then I
sir.
will send you the links. You can share with your friends. You can add the
Yes,
group
sir.
in the Telegram channel. There are a lot of
Okay.
things we are explaining and helping. Okay.
Okay, sir.
How
Okay,
many
sir.
of you are interested in a speaking warm-up session? You just send me a message, sir, I want to do a warm-up session. So those students, I'll give a warm-up session, live session. So you can send me personally a message. Sir, I want to do one warm-up session with you. So I'll give one example now. So now the example will be for whom? Because those students who are there here seriously till the last, those people I'll give. Who is there till here? Uppula Srilata. Yeah. This is one favorite student. When she came to India, she spent one day and came to my house and visited. Mad girl.
Good evening, sir.
Hello, Srilata. Are you ready?
Sir. Yeah. Yes, sir.
Okay. Fine. All of you, silent, everyone else. I'm locking. And I'm going to take one speaking session, rough session, that's all. Mute all. And what's the name of this girl? Uppula Srilata. You will be opening your video and I will be opening my video. Okay. Yeah. So here is, where is that? Where is that? Okay. Yeah, my video is here. Yes. Okay. Fine. Right. So I'm going to take a session. This is how the session will go now. My sessions will be totally different from others' sessions. Okay, they have different styles. So don't get worried and tensed. I'll give you a lot of practice. Those who are really interested, you can come. Otherwise, you can stay back. If you want extraordinary quality, you can message me. Here is a warm-up. Warm-up session, Muhammad Ibrahim Sharif. Warm-up session. Not this. Open. Ibrahim Sharif. Okay. Yeah. warm up. Open file location. Okay. Okay, just I'm giving you a rough idea. No problem. This is a medicine, but I will change it into, okay. I cannot search just a few minutes. Just practice. Hello, Srilata. Hello, Srilata. Srilata. Where is Srilata? Yes, Srilata, unmute, please.
So good evening, sir.
Yeah, good evening. I'm just giving you a rough explanation example. Okay. This is actually a medicine question paper, but I'm giving you okay. Yeah, Srilata, can you please tell me something about yourself in 3 to 4 sentences?
Well, let me take a moment to introduce myself to you, sir, as it gives me a great pleasure. I'm Upura Srilata. I'm a nurse. I work in Saudi Arabia, and I've done my master's in nursing. I'm basically Indian, and from the state of Telangana.
Right. Why did you choose nursing as your profession?
Well, I was very passionate to work as a nurse because when I was a kid, I have been admitted to the hospital where the nurses were taking very good care of me. And that really moved me to go further in my career to be as a nurse.
What is your fundamental reason for taking the occupational English test?
The basic idea of taking occupational English test is to really work in Western countries and have a better lifestyle and a good working environment. And this is also one of my parents' dream to work in other countries.
Which country is your most favorite destination for migration and work?
I prefer working in United Kingdom as it is really a fast trending country, and updated knowledge and updated working skills with perfect updated equipment is used in my profession. So I think I would be really great to be working there.
Comment on the special quality of the contemporary or the present generation nurses.
As a nurse, it is a very challenging work at the workplace. We play a different roles as a multitasker. So I think being a nurse is really a blessed profession, I feel. And the challenges are very much tasking at the workplace, which we will be able to cooperate and collaborate with the working team.
What is the regular routine of an ideal nurse?
The routine work usually starts in the early morning with a word of a prayer to ourselves, and the day routine starts with handing over and having a debriefing of the previous shift procedures, and then what is to be done for the whole performance of this day would be carried out. This is how the work goes on.
As far as your role profession is concerned, who is your role model?
In my profession, I don't specifically say as a role model. I would love to learn from every individual as a nurse, because everybody has a special quality where I would be learning from them or seeking from them, and I would go forward based on their goodness of qualities in them.
Right, that's a very nice talking to you, Uppula Srilata. Thank you very much. Have a nice day.
Thank you, sir.
Okay, this is how our speaking warm-up sessions will be. Our training sessions will be, especially with me. So you can practice personal sessions. Okay. And then, yeah. So we had our session for listening. Okay, we have completed our session, and have a nice day. And we'll have a break if everything, if my body permits, we are going to have another session that is a reading session. I'll be providing the link today. Yeah, otherwise tomorrow morning. Thank you and have a nice day. Bye-bye.